Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. Susan Salenger is the author and researcher behind Sidelined, How Women Can Navigate a Broken Healthcare System. Sidelined examines the many ways in which some women manage and sometimes mismanage their healthcare. Born and raised in LA, Susan attended UCLA to study English. After graduation, she worked alongside her husband, Fred, for 25 years at their production company, Salenger Films, which produced corporate training and development films distributed worldwide. Today, at age 80, Susan lives in Northern California to be near her incredible family, which includes her 2 daughters, 4 grandchildren, a cat named Max, and a dog named JD. When she is not speaking about her book or spending time with family and friends, you will find Susan powerlifting to stay in shape. That is incredible, Susan. I'm super excited for this conversation today, so welcome to the show.
Well, thank you so much. I'm delighted to be here, and thanks for inviting me.
Awesome. Well, we have already one thing in common. Your husband's name is Fred, and my other half is a firefighter named Fred. You don't meet very many Freds.
Well, and my son-in-law is a firefighter. He's not a Fred, but he's a firefighter.
Oh, awesome. Well, I'm really excited for this conversation. Let's first go back to really how you got into what you're doing and what inspired you to write this book, Sidelined. So tell us a little bit more about your background.
Well, it was just kind of a journey. Years and years and years ago, when I was in like my 30s or 40s, I had some exploratory surgery that I knew I didn't need. I was taking some new meds, had developed some symptoms, and I was positive they were due to the new meds. The doctor didn't agree. To make a very long story short, I agreed to have some exploratory surgery. Everything was fine. I went back on the old meds, and that was that. But I was really angry at myself for making such a ridiculous decision. I had options. I could have waited a week. I could have gotten a second opinion, but I didn't. Okay. Then fast forward to many years later, my husband and I sold our business and I retired for 2 or 3 seconds. It just didn't work for me. So I went back to school and took some anthropology classes. And I did a project for one of the classes on women who had hysterectomies. And several of them had agreed to that surgery, which they were really unsure they didn't need. In fact, 2 of them were pretty sure that their symptoms were premenopausal. So that triggered my memory. And so I kind of wondered how, as women, do we make our medical decisions? And that's kind of got me into the book. I interviewed, I guess, about 60 women, all with different diseases. And I wanted to know how they arrived at their decisions. How did they feel about the decisions they made, etc. And I extrapolated just a bunch of stuff they had in common. For example, women put themselves last, women hesitate to get a second opinion, as I did, etc. So that's really how I got into the book. It was a long journey and in a way a serendipitous one. But
yeah,
anyway,
awesome. Well, it's interesting how we usually get to where we are today because of something that happened to us, right? So you're a good example for that. Awesome. So what are some common hurdles women need to overcome to improve their health care?
Well, I think the first thing is we need to stop putting ourselves last. In fact, on the contrary, we need to put ourselves first. I didn't know this until I did my research, but women do, I think it's like 80% of the caretaking worldwide. I mean, that's a phenomenal number. It's universal. And we really can't take care of others nearly as well if we don't feel good. I mean, think about it. If you're feeling lousy and you're tired and you're irritable and you have no appetite, etc., you're not going to be in as good a place to take care of those people who you need to take care of. So I think the first thing we need to do is really learn to put ourselves first. You'll be a better caretaker if you do. And the second thing that really surprised me is that women hesitate to get second opinions, as I did. And that now I realize what a huge mistake that is. There's just so many diseases out there, and doctors can so easily make a diagnostic mistake. not because they're incompetent, just because there's so many choices, so many of there must be 40,000 diseases out there, literally, and many of them have the same symptoms. So for a doctor, a diagnosis is like looking for a needle in a haystack. So there's certainly some good reasons to get a second opinion. And then I found, I'm sorry, go on.
No, I was just going to touch on the second opinion. Why do you think that we do not get second opinions?
I think it's how we're socialized. We've been taught to be nice, to take care of others. So we take care of each. We don't want to hurt their feelings. We don't want to be rude. Although actually one woman said to me she would never get a second opinion because she was afraid she'd be marked as a bad patient or a difficult patient. And that would go in her chart and literally follow her throughout her medical career, if you can use the word.
Yeah.
Career. So I think that we've been, how do I say it? We're just taught to be nice people. And we are nice people. That's part of the problem. And I think another reason is we all think of a second opinion as confrontational, and it really isn't. In fact, I was on a podcast with a doctor, and she said she loves it when patients get a second opinion. First, because diagnoses can be difficult. Misdiagnosis is one of the leading causes of death. So, I mean, it's nothing to screw around with. But also, she said, frankly, if her diagnosis is confirmed, that's great. And it helps with if there's a medical malpractice suit for any reason, she has some backup. So she really appreciated a second opinion.
Yeah,
so I think
absolutely.
It's not a confrontation at all. It depends how you phrase it, I guess. But
And I think, too, with my experience, is as women, we're very loyal, too. So oftentimes you don't want to hurt or feel like you hurt your doctor's feelings if you're like, oh man, I don't believe you, or maybe I want to get another second opinion to see if you're missing something or not missing something. So I think that's a lot of it too. When I hear of women saying, oh, I went to my doctor and they said that I was normal, or there wasn't anything wrong with me, or oh, here's birth control. Like they just assume that that's their only option. But just like you said, there's tons of different options. So, I try and advocate for women too. It's like, no, you can ask someone else. You can get another physician. You can seek a second opinion. Like you're not stuck or tied to that diagnosis or that option. Like there's tons of other ways to treat, this condition or that diagnosis. Just like you said, there's other ways. And that's the thing with conventional medicine sometimes though, is we do see that one side approach. It's like, oh, you have this, take that. And that's your only option. Yes. But, alternative medicine and functional medicine, and we have all these other ways to treat disease now, that there are other options. So I love that you advocate for that.
What I found, two things that I found particularly interesting. I mean, doctors are human. I mean, obviously they're people. And we all see what we expect to see. So the very same symptoms will be a stomach issue to a gastroenterologist, joint issue maybe to a rheumatologist, stress to a psychologist. So a second opinion from somebody in a totally different field. I would not go to somebody in the same office. It can be very, very helpful, particularly if you have something like breast cancer or a serious diagnosis. I mean, I'm not saying for strep throat, there's a test for that. But basically, and I think the way I've been taught to phrase it is I would say something to the effect, look, I know you've seen a lot of patients with my symptoms. Have they all had disease X, or what in your experience could this possibly be? And either the doctor will say it could be disease Y or Z or A or B, or then you can say, well, why don't, let me get a second opinion. How do you feel about that or something?
Yeah.
Not confrontational at all.
No.
And it gets the job done. Let's put it that way.
Yeah. And you probably, as a patient, you learn more too.
Right. I'm a huge advocate of research. And if you say, what else could this possibly be? And you get one or two other names that you can, go home and look up, you're that much better off. Because the disease has to feel like a good fit. Otherwise, you won't follow through and just taking your meds, following through with the treatment is a big issue. And so if you disagree with the diagnosis, you're more than likely not to follow through with the treatment because you're not convinced with the disease in the first place. So I think it's a really good idea to research and see if you think the disease fits your symptoms, how you're feeling, etc.
Mm-hmm. Oh, yeah. Good advice. So you mentioned the second opinion. The first part was putting ourselves first. Was there anything else that we need, or some common hurdles that you've seen that we need to overcome?
I'm curious if you've experienced this in your practice, because it's so different. But I was very surprised at the number of women, and I would say the majority of women, who felt shame that they were ill and embarrassed and apologized and had never talked to anybody else other than their doctor about their illness. In fact, I put together a couple of focus groups just because I wanted geographical diversity. And the women in the focus groups were so delighted to be there. They had never talked with anybody other than their doctor about their illness. And they were so excited to find out that other people, other women, regardless again of their disease, had the same issues, childcare or pain or whatever their issues were. It was really exciting. I don't feel ashamed when I'm sick. I just get pissed off. So we don't
have time for that, right?
I don't,
Nobody has time for that. That's why you need to be proactive about your health now, and you don't need to be sick to go to the doctor.
Right.
So,
but do you find that in your practice as well? Shame? You do.
Absolutely. Yep. It's unfortunate. But
yes,
I just tell women, I'm like, you know what? You're not alone. I hear this all the time. And you're not the only person that's experiencing this. And I think a lot of it is what they've been told, and why they've been told that they're just a tired mom, or they need to sleep more, or maybe that they're depressed. They're like, I'm not depressed. I'm not a tired mom. Like, there's something wrong with me. So then they start feeling like they did it to themselves, where it's not the case.
No, absolutely. And I think it's really important to remember that, a lot of the time it's the luck of the draw. Some people get COVID and some don't, and some smokers get lung cancer and some don't. And some people that don't smoke get lung cancer. Yeah. It's just a question, partly a question of luck. I'm not going to say that if you smoke, obviously you increase your chances.
For sure.
But it isn't necessarily a done deal.
Right. So what is the best way to find the most competent doctors?
That's a really good question. In fact, I like that question. And there's two answers. The first is you go to the resource list in the back of my book. The book is really lovely. What's particularly important about it is the resource list in the back. And I say that because it tells you how to find a doctor. You want to research a hospital. Some hospitals specialize in cardiology, others in neurology. You want to make sure you're going to a hospital that has an A rating. You want to check out your disease. There's all kinds of reliable websites that I give you so that you don't get so much of the misinformation that's on just Google. I really recommend it. But to answer your question even more directly, is I always research a doctor, and I find out where they were trained, and I look at whether it's Yahoo or whatever. It's also in the back of my book. I forget what it is, but I look to see if if they've had any malpractice suits. Have there been a lot of negative publicity, whatever. So but particularly, what's their specialty? And I really want to know where they were trained. It sounds, how do I say it? It's no small thing.
No.
Somebody's trained at Stanford or UCLA, for example, or Johns Hopkins is probably much more competent and sees, because they're large hospitals, sees more cases than somebody trained at a smaller hospital in a smaller town. So I think that would, and also I would ask around if you know anybody. Another thing that I always add on is if you do have a disease, and there's a support group for it, and there's support groups for most diseases. See if anybody in that group has gone to the doctor you're thinking of, or who knows somebody in your area that may specialize in it. Support groups are huge vessels of information, or they can be. Put it that way.
Yeah, doing research on physicians is so important, especially if you're looking in the alternative medicine space, more so than a medical doctor, only because there's in my profession as a naturopathic doctor, like we like to call them undies. Like they call themselves naturopathic doctors, but they got a certificate online, and it says that they have their doctorate of naturopathy, which is terrifying. So making sure that you do your research, see where they went to school, go on, you know, the medical board sites, just like you said. So super important. Don't trust, you know, something that someone just puts on the internet and calls them whatever, because it might not be true, or they might not actually have the credential to practice medicine. Like for me, I went to an accredited naturopathic school, and people, we get called, you know, fake doctors all the time. And I said, well, I have a license to practice medicine. I have a DEA license. I can prescribe medications, you know, things like that. So I don't know what part of what I have as a credential makes me a fake doctor, but you can believe what you say or want. So, but there are people out there that say that they do what I do, and they're not real licensed naturopathic doctors. So super important to just, you know, do research, especially if you're in a situation with, you know, a diagnosis that is scary, you know, a cancer diagnosis or something that's really going to impact, you know, the way you feel, or maybe have surgery that's going to have a recovery process or whatever. And then again, do the second opinion. So,
you know, let me just interject.
Go ahead.
Go on, I promise. But
you're fine.
Ask a friend too.
Yep.
And I think it's important to get a recommendation, but, and it's a big but, put the but in caps. I think it's really important to also do the same research that you would even for your friend's doctor. Because, you know, sometimes you really like a doctor. That doesn't make them competent. It makes, you know, makes them a good dinner partner, perhaps. But, you know, you want to gauge their competence.
Yeah.
So, I mean, I think it's really good to get a name. But I also think it's really important to research that name.
Yeah. Awesome. What are your top 3 tips for women who want to better manage their health and decision-making capabilities?
Number 1, I think it's really, probably 1 and 3 are the same, but I think it's really important to advocate for yourself. You want to ask questions. You want to look, and it's really advocate. And let me back up a minute. By advocating, I mean research, speaking up and researching, because you want to speak up with knowledge. But you want to research what you've been told. You want to verify it, and you want to speak up if it doesn't hit you right. Don't do what I did and just agree to a surgery because you got frightened or whatever. I mean, truly, looking back at my own experience, as I said, I could have had gotten a second opinion. I could have waited a week and gone back on the old meds. I mean, it wasn't going to keel over. It wasn't an emergency situation. I just leaped into it. And so, I mean, this is a book of do what I say, not what I did. Because truly, you really want to take your time, think it through. And time is important. That's it's also part of advocacy, because you need time to process it.
Yeah. So
advocacy is speaking up. It's doing your own research and taking the time to absorb what you've been told and what you've researched. That's a good summation. I'll stop there. I like that.
And that's also too where you can phone a friend and ask in a support group, and you know, take the time and read what other people have experienced, and know that there's other options. It's not always just one path too. And I think that's, you know, we've been taught as a young age, like, oh, you have this, take this, or, oh, you've done this, this is what's going to happen. And it's not always the case in medicine. I mean, yes, there are paths, but you don't have to go down that path. You can explore other alternatives. So that's where the research comes in hand. And it's why do we have to be our own advocates nowadays? Why do you think that is?
Because I think, again, there's so many diseases out there. Well, first of all, I mean, let's be honest. Some doctors are idiots. That would be the first.
True.
Not a whole lot, thank God. But I mean, like everybody else. I mean, some plumbers are better than others, and it doesn't matter what we're talking about. So, I mean, I think that's the first thing, and that's yet another reason to research. But I think it's really important. It's so important to have your questions answered.
Yep.
And it's so important to have a good relationship with your doctor. And if you don't talk and ask the questions, if you're not comfortable and you have the resources, change doctors, because it helps your healing if you're comfortable and you have your questions answered and you feel confident that you've been heard and understood. So I think advocating for yourself, make sure that that happens.
Yeah,
You don't,
absolutely.
the statistic that I came across, which really shocked me, is that like only 15% of women will really tell the doctor when they don't understand something. So that means that over 80% of us don't. And you can't do that. I mean, it's your body. It's your job to take care of it. You can't just leave the doctor's office not understanding what you've been told. That's not
exactly.
good.
And it's from my own health experience. I mean, it's very overwhelming too when you're told that you have X or this is going on or the risk. So, ask for someone to come with you or take notes or ask to have it recorded. So that way you don't leave there feeling so overwhelmed and wait, what did she say? Or, or there was so much information. I don't know what to do. Sometimes you leave doctor's offices and you feel more confused than when you left than when you walked in.
Yeah. Right. So, absolutely.
Yeah.
Absolutely.
And they only have in conventional medicine, about 10 minutes to speak with you, if that. So it's a lot of information in a short amount of time. So that's why it's super important to come armed with your appropriate questions, your own research, a little background into what is the diagnosis you got so you can ask those questions. I love when my patients come in with a list of things either on their phone or a hand piece of paper, to cover all of the questions that they had, even though we usually go over it. But, I'm like, was there anything else on your list that we missed? And then we'll go, go through and answer those questions. But yeah, and I've learned that in social media, with my own patients, but a lot on social media, it's like you have to go in and ask your own questions. They're not always going to present the answer to you or give you the test that you want, by doing your own research. So that's why you say, can I get this done? And if they won't do it for you, then find another doctor that will. Right. Because there is someone out there that will help you and that will listen to you and will get you the answers that you deserve.
Absolutely. And I think it's really important, which we didn't really talk about, to go in with a written list because it organizes you, it focuses the visit, the doctor can review it, and perhaps go in with a written prioritized list so that you put the most important questions first. And maybe the last question you have could be the most important and you don't know it. That happened to another doctor whose show I was on. The last thing the patient mentioned was a mole on his back. And that would have been the first thing she had, she examined, not the last. She happened to mention it as she was walking out the door. So that's not good. I mean, if you have a written list, it gives the doctor a chance to reprioritize if they need to.
Yeah, absolutely. And I feel when I do that, because if anyone knows about my health history, I feel empowered, I think, when I go into the doctor having a list and being armed. It's like, I can maybe kind of I have obviously a medical background, so I really relate to their level. But if I didn't, I kind of feel like I'm almost at their level because I know what I'm talking about. And it's not like, wait, what is this? I don't understand what this means. So that way you can dive into more specific questions because you already have the background information and kind of know what you're getting into, right?
Right. Yes, absolutely. In fact, I had one doctor say to me, why don't you just leave the driving to us? I mean, I never went back, screw it.
Yeah. No. No, we need to be in this car together.
Of course. Absolutely. Yeah. And I want to know not only what I have, but why you're prescribing, what you're prescribing, why this treatment, not that treatment. I mean, I need to understand. I need the information makes me feel more in control.
Yeah. And even specifically asking, do I have any other option?
Right. Love it.
Yeah. Because sometimes, and it's unfortunate, a lot of doctors are paid by these pharmaceutical companies. And I've, done tons of shadowing in medical offices and seen these providers come in and they spoil them with lunches and, sometimes. And it was the same in medical school, too. Like we had our favorites with supplement brands and things like that. So, again, you're allowed to ask if you have other options. It's 100% okay. And there are other options. And if someone says, no, this is your only option, most definitely get a second opinion.
Right. Absolutely.
Yeah.
Absolutely.
Awesome, Susan. I love what you're doing. Is there anything that we missed that you wanted to touch more about?
No,
there's
I
a
don't
giant
think so.
moth in here.
In my place or yours? In your place, I hope.
No, in the studio here. So I hope I don't squeal, Bill.
Oh,
I think
no,
I think it landed. So we're good for right now.
They just will live in one place, which is fine.
Real life, people, real life. Sorry about that. So is there anything else that you wanted to add?
Not really. Just, again, it's your body. Take care of it.
Yeah, you only have one body to live in, right?
You got it. Absolutely.
Yeah. Awesome. Well, we'll wrap this up with a question I ask all of my favorite or all of my podcast guests. You might have just answered it, but what is your best or favorite health tip that you can share with the audience?
Oh, I haven't answered. I think exercise. Keep moving. To stay healthy, I think exercise. I don't like exercising. In fact, I dislike it. But I do it religiously, and because I'm 81. I had a birthday since we did that.
Oh, well, happy birthday!
Oh, thank you. But nevertheless, I'm still full of energy. I move. I mean, it's genetics and good luck. I'm not going to say it isn't, but it's also working out, and I think it's really important. And yes, it's boring, and yes, it's hard, and all of those things, and do it anyway. But
it's so good for us, right?
It is, and
especially women.
Well, it's the best way to get older is to prepare for it. And Jane Fonda
good advice.
said that. I know I'm going to be quoting Jane Fonda, but she's right. And look at her. I mean, she's in great shape.
Yeah, look at you. You look wonderful.
Well, thank you. It's the exercise.
Yeah. Well, Susan has a lot of free resources and tips on her website, so we'll make sure to include that and a link for her book, Sidelined. And again, thank you, Susan, for sharing all of your knowledge. I hope you inspired at least one woman out there to take control of their health, be their own advocate, ask the questions, get the second opinion. So keep on advocating for us. And again, thank you for being on the show.
Oh, thanks for inviting me.
Of course. Have a great day.
You too.